Good afternoon, everyone. This is Miss Owen, and I'm your simulation educator today. And the topic of our scenario is communication at point of care. Thank you for being here, being prepared with your handouts, your computers open. Do we have any questions before we get started? Okay. Let's begin with objectives. So we are going to identify the importance of clear, concise communication at point of care. And we're going to differentiate an SBAR and a handoff report right here in our briefing. And then we're going to go into the scenario where you're going to have the opportunity to demonstrate using an SBAR communication technique by reporting abnormal findings to a healthcare professional following the assessment of a pediatric patient, baby Clara. And then during our debriefing, you'll have a chance to reflect on patient safety goals related to communication between nurses and healthcare professionals. Do you have any questions on objectives? Okay, excellent. We know that every time we come to simulation, how important communication is. We mention it, we talk about it, review Joint Commission safety standards. And if we see up on the screen, we have right here, to improve staff communication, to get important results to the right staff person on time. So communication is this giving and receiving of information. And we do it in real life and we do it in the hospital. But in the hospital, there's very specific techniques. I would like you to start off by just watching this quick little commercial clip. It's pretty funny, so pay close attention, and then we're going to talk about communication. Okay, so what were some of the communication barriers in the video? Okay, yes, correct, right? They couldn't hear. They weren't paying attention. They were distracted. Excellent. What do you think some communication barriers might be in the hospital or in a healthcare setting? Amy. Okay, good. Good. Right, yeah, it just makes it even more difficult to communicate when there's so much is happening, right? You could be stressed and a lot of action is going on. Something new might be happening. Patients are coming and going. Excellent ideas. Good job. So based on your homework video, let's stop and think about the Team Steps video with Mrs. Sheridan and her son Cal. Can someone please describe or summarize the communication problem that occurred with Mrs. Sheridan's son Cal? Okay, Ryan. Okay. Excellent. Yeah, very good. Very sad. And communication could have definitely helped. We forget sometimes that omitting information or not picking up assessment data, not thinking through what we are doing with our patients might be cause for reporting or not reporting something. So being able to include pertinent information from a patient is very important for communication. Good. So also now let's talk about some good qualities of communication. What are some qualities of good communication? Amy? Yes? Speaking clearly. Slowly, right? Okay. Language barriers, absolutely, if someone speaks a different language. right? You have your rubric in front of you that we're going to be following for our SBAR report today. So they give some other great ideas too. Anybody else want to add anything from your homework? So who's comfortable giving an SBAR report? Not quite sure. Let's talk about that a little bit more. You haven't done it, so this is a great place to do that. Let's go onto this page where I talk about our pocket guide. So please, I hope everybody downloaded it like you were supposed to for your homework. If not, the link is here. You will have these handouts for you later that you can look it up. But we see that there's 5 different communication techniques. In today's scenario, we are just talking about the SBAR and the handoff, but you can see that there's other things as well. Okay, and we will do these in other scenarios, just not today. Please, Monique, describe to me what the definition of an SBAR is based on our Team Steps guide. Okay, good. And Ryan, again, can you describe what a handoff is from your Team Steps? Very good. Okay. Okay. Excellent. Okay, so these are specific skills, like kind of riding a bicycle. We need to practice it, and the more we practice it, the better we will become. All right, so let's talk about the confusion that there is between an SBAR and a handoff. And I'm actually running this scenario, created this scenario for you based on the feedback from other students here at school. They say, well, we don't really know how to do that. And when we get to the hospital in the morning, we get an SBAR report. Well, that's really not an SBAR report, but they're calling it an SBAR report. So part of the confusion is that each hospital, each agency uses their own terminology. So it is important to recognize that different places use different terms. It could be a bedside report, they could call it a handoff. Something in an emergency report could be called a handoff, or a shift report, handoff, or an SBAR. So there's a lot of confusion. By following Team Steps, it is very clear what technique is needed in what particular situation. Okay, and that's what we're going to practice today. The key is to understand that communication with another healthcare provider is very structured. It is a skill, and that information is clearly and accurately exchanged between ourselves and those other healthcare providers. So with a handoff report, we give those at a change of shift, so you get them in the morning when you come to clinical. That's a handoff. Team Steps uses the I pass the baton, which is what we're actually going to practice in a minute with baby Clara. I will give you an example. And it is a very long and complete report. Right? The SBAR, on the other hand, is when we kind of get right to the point. We report critical information that requires not only immediate attention, but it requires action, immediate action. We have to do something about it. Okay? We are going to verbalize it today, right, on your telephone, so you're each going to get a telephone. And you're going to be able to document in our electronic health records how to formulate an SBAR report. And that's what we're going to do. Do we have any questions? Any further questions? Oh, great question. The I in SBAR stands for identification. I always put it there in front of SBAR. So we have our situation, our background, our assessment, and our recommendation. But the I is identifying myself to the other provider, identifying who the provider is, and identifying who the patient is, so that everybody's on the same page with who is who. Okay? And that is how we begin each of the reports before we go ahead into what the situation is. All right? Any questions at this time? Any more questions? Okay. So in pediatrics specifically, certain situations you might see that we would need to report in an SBAR based on our findings on our assessment, our vital sign changes, anything that has to do with bleeding or abnormal lab values, an extreme increase in pain, something that is a new onset of pain. I know that you're doing care of the family, so and pediatrics is part of that course where you're going in to labor and delivery as well, so you have decelerations on any of your monitors or any other monitors that there might be a change that needs to be reported. So these are things that need, again, immediate attention. They need to be reported and action needs to be taken. All right, so that's situations right in this course that you're in right now. Do we have any last minute questions before we go into our scenario? Okay, so this is going to end our briefing session, and we're going to go actually into the scenario. We will, please take out your handouts. You can leave your computers open. You can leave them here in the conference room. We will return and we will document later. Here is your telephone. And we're going to give you quick directions here. We're going to pair off into teams, so we're working together. I will be giving you a handoff report, so you'll see exactly what a handoff report is and how it's different later on than an SBAR. We're going to gather assessment data. There's going to be a demonstration of an assessment on baby Clara. And from that, as if everybody did the assessment, there's going to be some abnormal findings. You're going to organize those abnormal findings and create an SBAR on your handout, on your hard copy of the paper that I gave you. All right? And we're going to then, after you formulate what you're going to write, you are then going to make the phone call, and you're going to practice that through role playing. Do we have any questions? So here, we will go into our handoff report. And here's what a handoff report sounds like. Hi, I'm Nancy. I was a nurse who just completed admission for baby Clara and cared for her throughout the day. She was admitted at 3 p.m. Her name is Clara Sims. Date of birth, 10/25/17. She's 6 months old, female, and she is in room 203. She was admitted for respiratory distress about 3 p.m., and her vital signs are temp 99.9. Her apical heart rate is 120, respiratory rate 36. Her SpO2 is 98% on 1 liter nasal cannula with humidification. Her lab reports and chest x-rays are pending. She has no known allergies, and emergency supplies are in the patient's room. So baby Clara's been healthy since a full-term vaginal delivery 6 months ago. There's no prior admissions, no home medications. Baby is a first child of mom and dad, both of which are involved in care. There's a need for continued respiratory monitoring. About an hour ago, respiratory administered a treatment, and respiratory status has improved. There's no further grunting or retractions, but there continues to be expiratory wheezing bilaterally in the upper and the lower lobes and occasional cough. Respiratory rate is 32 to 36 and regular, with equal rise and fall of the chest. Please continue monitoring for changes in this status. Also continue to monitor a temp, as it has been increasing since admission. There's nothing urgent at this time. Dr. Williams is the primary provider from Hospital Clinical Services, who will be on call throughout the night. Rose and John are the parents, and they plan to stay for the night. They are very helpful, but also very anxious. We're waiting for results of blood work and a chest x-ray. I would anticipate potential for continued respiratory distress and needing another respiratory treatment, which would be due in about an hour. There's also potential increase for the temperature to increase. Do you have any questions? Okay, so now we're going to end this, and we will go into the unit, the pediatric unit, and take care of baby Clara.